Well, earlier this week, the world was certainly shocked when E! News host Juliana Rancic came out with her big announcement that she has breast cancer. She's only 37 years old. It was shocking.
Yeah, and just a couple of weeks before that, we heard Andrea Mitchell from NBC News. She had the terrible news. More and more we're finding out that this is the case, and Dr. Assil Saleh is here to help us with this. Good morning.
Good morning to you both.
It's scary, you know. She was doing in vitro, Juliana Rancic, and they said, you know, get this test just to make sure, and she had it. It's scary.
It is, absolutely. I mean, as we all know, breast cancer is the most common cancer in women, and it's one of the leading causes of death. And what Juliana did right was to get screened, and her cancer was detected early, so hopefully her outcome will be very favorable.
So what is she expected to go through now?
Well, she will go through a number of diagnostic tests, staging, and so on, and then she, along with her physicians and medical team, will come up with a plan, treatment plan.
Okay.
And this is individual because everyone's different, and
Absolutely.
every treatment plan is different.
Everybody is different. We all have different profile of risk factors, exposures, and so on, and it depends on the type of cancer and the spread and so on.
Well, you said this is the most common form of cancer.
Correct.
Can you give us some numbers? I mean, how many does it really strike?
Well, the year 2011, we expecting to have about 250,000 cases of breast cancer this year, and 40,000 women will die this year of breast cancer. So it's really a fairly tremendous problem.
You say that everybody's different, every woman has a different situation, but that task force that came out recently and said, you know, wait until you're 50, don't do it at 40.
Right.
That really doesn't seem to make sense.
Well, we follow, as physicians, we follow the American Cancer Society recommendations, and what we tell people is that breast cancer's risk increase as we age. So start to get acquainted with your breasts. At the age of 21, start self-breast examinations every month. At the age of 21, do go to your primary care provider or gynecologist or healthcare provider and get a clinical breast exam. And then at the age of 40, we start screening mammograms. Of course, if people have stronger risk factors such as family history or genetic mutations, then we may start at an earlier age.
Yeah, let's talk about that because there are different risk factors. Some people, it's traced back to a gene, right? It's hereditary.
Right.
And for others, it is not.
That's exactly right.
So that means all women really need to sit up and take notice about this disease.
Absolutely, you're absolutely correct. About 15% of people with breast cancer have either a family history or a genetic mutation. And we talk about family history, either a mother or a first relative, a mother, an aunt or a daughter or a sister. So that leaves about 85% of the population of the women who are diagnosed with breast cancer with no significant family history. So you're absolutely right that every single woman should be aware of this and should be taking the right and necessary steps to make sure that she's doing the right things to prevent cancer and to screen early, and then eventually to be treated appropriately and early.
When you're doing this self-exam, you know, depending on honestly what time of the month it is, you can be a little bumpy, and let's be honest here. So it can be a scary process to do that. What do you feel for?
Well, you know, you brought up a very important point, and that is our breast tissue changes with our hormones, with the cycle. So we recommend for people to examine their breasts at the very same time every month. So some people pick day 20 and they go for it. It's important just to get acquainted with the breast. So if you feel a lump or a cyst that a few days later is still there or a week later is still there, bring it to the attention of your provider. If you feel lymph nodes or lumps and bumps under your armpit, bring it to the attention of your provider. So anything that women are not sure of, they should go and get it checked out.
And speaking of lumps and bumps, I mean, if you have fibrous breasts, I understand there's certain foods like coffee, for example, that can actually make it worse.
Yeah, and fibrous breast is interesting, and women with that disease, we call it disease by entity, tend to have a harder time examining their breasts. But coffee, smoking, other lifestyle risk factors can affect that, and can actually also affect the potential risk of developing breast cancer. So we do recommend that women stay healthy, so exercise as much as you can, avoid eating fatty food, avoid excessive weight gain, and be healthy overall. Alcohol, interestingly, also can affect the risk of breast cancer. So No more than the one recommended
let's
drink.
Talk about that. What is the limit?
No more than the one recommended alcoholic beverage a day would be the recommendation. Anything, it has proven that anything between 2 and 5 alcoholic beverages a day is associated with a higher risk of breast cancer.
Well, it's better than I was thinking. I was thinking like 2 a week. I mean, one a day. You could have a glass of wine with dinner.
That's exactly right.
So at least you feel like you could still enjoy that if that's what you like to have. You know, when people are diagnosed with breast cancer, I think what's so scary is they're thinking at how bad the treatment could be. You know, it can be really rough for some women.
Yes.
I mean, chemo, you know, you can feel like vomiting, and the radiation, your hair is going to be going.
Sure.
Can you talk about some of the treatments and some of the options and what's coming out on the horizon too?
Sure. Well, and again, it depends on the stage that the cancer is caught at. So most often women go for some form of surgery, whether radical mastectomy or mastectomy and removal of the entire breast, or breast conserving surgery, so removal of the lumpectomy. Most often women are offered radiation therapy, and there was a recent report that came out this week in The Lancet that basically showed that radiation therapy in combination with breast conserving surgery is very effective at reducing the risk of recurrence, so the cancer does not come back, but also survival in the long run. And then chemotherapy, hormonal therapy, and so it really depends on the genetics of the cancer and the stage and so on.
Definitely want to talk it over with your doctor to figure out what way you're going to go as far as treatment
And it's
goes.
very important to ask your doctor. Any question is a very important question to you, so be involved and take action and be actively involved in this.
It's a good message.
Yeah.
Dr. Assil, thanks so much for coming in to talk about this important topic.
Thank you.